I am super excited today to be with two leaders in the cognitive health space. And we're going to have a discussion about an exciting partnership and some resources that I think are truly amazing. Dr. Doug Elwood, let me start with you. You are the chief medical officer, I believe, at Sunday Health. Tell us a little bit about yourself and your organization.
Yeah, Steve, thanks for having us here. It's great to be here. So again, my name is Doug Elwood. As you said, I'm the Chief Medical Officer of Sunday Health. I'm a physician by training, but I've spent the majority of my career actually focused on access and what that looks like to get patients into care that they need in different subpopulations in different areas, and really how we can do that most effectively. So I got into the dementia world not so long ago, and mostly for personal reasons. And it's a space that I've come to realize really needs a lot of help from an access perspective. And that's what we're here to talk about today.
And Sunday Health, and I know because I have gone through your process of cognitive baseline evaluation. Tell us a little bit about, Sunday Health in general, the vision and what you all are doing.
Absolutely. So Sunday Health is a live cognitive practice. So we like to call ourselves a modern cognitive care, and modern has a lot of connotations to it, which we'll go through in this discussion. But we are live in the DMV area and expanding to other geographies as well. And we're very much focused on the idea that early identification is really important. So, how do we get individuals to understand their cognitive baseline and start to approach cognitive care very much like they do for other parts of their body, right? We go through prevention for cancers, we go through early identification for things like diabetes and cholesterol and heart health. So we're bringing that same methodology to brain health and trying to get patients to be more familiar with undergoing real routine preventive care over time. And then we do the full suite of services. We have clinical neurologists, we have care navigators, we have nurse practitioners, and we have great partners, as Dr. MacSweeney will go into, who we can send for clinical trials and infusions. So we really try to wrap around services as much as we can for individuals with the focus on identification early and moving them into a continuum of care.
And I was blown away at the experience when I went through the process and the fact that I have a cognitive baseline that I can uh, use as a reference point later in life, or if something happens to me. I feel so fortunate, and I wish everybody was doing the same thing. Well, Dr. MacSweeney, this is a great transition to you. You are the founder and CEO of Recognition Health. Tell us a little bit about your background and then Recognition Health, and then we're going to jump into how both of your organizations are working together.
Great, thank you very much. So, as you said, I'm CEO and co-founder of Recognition Health. This is a company which is operating both in the UK and also in the US. And we really set up Recognition Health in 2011 because we recognized that there was a real sort of like dearth of services in terms of really early, accurate diagnosis and access, even then, to the latest type of treatments for neurodegenerative diseases. And obviously, as we're going to be talking about today, Alzheimer's is the most common of those and is today a pandemic. But also, we work in the neurodevelopmental space and we do a lot in traumatic brain injury. So we really cover the spectrum of brain and mind diseases and conditions. But we're particularly excited at the moment because the advances in research and development in the neurodegenerative space, and again, specifically for Alzheimer's disease, are moving at a phenomenal pace. And we've been involved in the clinical trials for the new generation medications that are now just emerging on the market. And we've been sort of very fortunate to see this progress and development over the last few years, and delighted now to share that experience for the patients that Sunday Health are treating too.
All right. Well, this is a great transition to kind of jump into how both of your organizations are working together. And then I would love to pick both of your brains on what's out there in the future, like in terms of, it seems like every other week I get some press release on the launch or of a new treatment or drug, and how, as consumers and professionals working with older adults, should we be evaluating this information? But I'll let y'all talk. How is this collaboration working?
Yeah, we can start with the collaboration. I can jump in and obviously invite Dr. MacSweeney to weigh in as well. I mean, I'd say this is a real true collaboration. It's very bi-directional. We've already been sending patients to the clinics, Recognition, and we mentioned modern for Sunday Health and moving upstream. The real part of that modern approach is the medications and the clinical trials and the ability to seamlessly send patients to a really high quality group. And that's what we have here with this collaboration. So when we identify a patient who might be suitable for a clinical trial, obviously we talk to them about that. And if they agree to it, then we refer over. The same thing is true with the medications. Right now, those are infusions. So you want to make sure that you go to a high quality center that is able to do that and is able to monitor in the appropriate methodology. And that's, again, what we have with Recognition. So that's been a very positive element for us. And conversely, as Dr. MacSweeney would tell you, some patients come and they don't have providers, they don't have neurologists, or they want more longitudinal care around the clinical trial or around the infusion, and that's what we can provide them. So it's a real nice collaboration in that way.
Well,
Sorry.
Oh, no, I was gonna say, one of the things oftentimes I want to get down to basics here, is that oftentimes you hear people talking about, oh, I got into this clinical trial. And I'm assuming it's very important that that individual is qualified. And then with clinical trials, is there payment involved, or what are some of the benefits to being involved in a clinical trial?
Thank you. So I think the first thing to say is the overwhelming benefit of being in a clinical trial is the opportunity to get early access to new generation medications. Now, particularly, we do trials across many different clinical conditions, from autism to migraine to Alzheimer's and Parkinson's, etc. But let's just focus on the patients for Alzheimer's disease. And up till very recently, and I think we're going to be talking about this in a minute, up till very recently, there have been no medications at all available on the market which can actually treat the underlying pathology in Alzheimer's disease. So in other words, can actually slow down further progression of disease and symptoms. So the only way that people could access those medications was through clinical trials. And when individuals volunteer or are interested in joining a clinical trial, the first thing is that they go through, and particularly for these Alzheimer's drugs, they will go through a very thorough screening process. And that screening process is essentially working out whether that individual, A, has the condition that the medication is designed to treat, but also that their level of cognitive impairment is within the sweet spot for where that medication is designed to treat optimally, and also to make sure that they're otherwise fit and well. So they haven't got some other sort of like cause for their cognitive problems, or they've got an underlying significant, as yet unrecognized health problem. So they go through a very thorough screening process, which is actually like a fantastic sort of like high-level executive medical screening, if you like. And then if they satisfy all the eligibility criteria, then they will be randomized into taking active medication or placebo. And neither we nor the individual will know which group they're in. But in most of the clinical trials, at the end of that randomized period, when you could be taking active or placebo, which is like a dummy drug, At the end of that period, then everybody gets the active medication. Now, obviously, if a medication is not being demonstrated to be effective, not doing what it's meant to do, it's not tracking to its endpoints, then a study will be stopped. So an individual doesn't tend to stay on a study that is not tracking to its endpoints. So the advantage for an individual now and sort of like previously, which is why we felt that if we were providing the best service for people with cognitive problems, we needed to also be operating in the clinical trial space, because it's giving people access to the latest, most sophisticated biomarkers. And we should talk about that in a minute, because it's a very important part of early, accurate diagnosis of Alzheimer's. But secondly, it gives them the opportunity to get access to a disease-modifying medication. And the first person to be effectively, if you like, ultimately cured or prevented from developing Alzheimer's will be in a clinical trial by definition. So we'll talk in a minute, but the sort of like historic change that's taken place in the last sort of like year, 18 months, is the fact that the first two medications that have successfully come through the clinical trials and been approved by FDA and actually most of the other regulatory authorities across the world, they are now available, and they're available sort of like across the US for people. But what I have to emphasize, it's with an accurate biomarker diagnosis, and we can talk about that, but also with mild symptoms. So any medication that is designed to slow something down or to treat something that's progressive, like blood pressure, diabetes, anything, cancer, it's most effective when given really early. And this is one of the most important things, and is key in how we're working with Sunday Health, because Sunday Health are working with us to identify people really early, to intervene. And obviously, because this is a progressive problem, we also see lots of patients for whom they've missed that early chance and opportunity, and they really do need ongoing, close medical attention, which is fantastic, because Sunday Health are providing that whole support and expertise for those individuals.
Wow, great explanation. And I think this is an amazing partnership. I can see the support going both ways. But you've piqued my interest on these drugs and these new treatments. Can you dive a little bit deeper into that?
Sure. And actually, I'm going to preface it by saying, and I hope everybody sees this, there was a new report that came out by the Alzheimer's Association on the 29th of April, so just 2 days ago. And it actually confirmed what I know, and I believe Doug knows firsthand. And in fact, the whole reason we created Recognition Health, and the whole reason Doug created Sunday Health, and that is that it's up in the 90s in terms of the percentage of people who want an early, accurate diagnosis, and they want to know what is the cause of their cognitive problem. And the earlier, as I say, this can be detected, the better. So the way the new medications work at a like very sort of like high level, they are designed to remove something called amyloid protein from the brain. This amyloid protein is something we sort of all have, but for some reason, and the biggest risk for this is just age, for some reason, as we get older, a significant number of people will overaccumulate toxic levels of this amyloid protein, which then becomes insoluble. And there are two medications. One is called Kisunla, one is called Leqembi, and they are both in the same class. And they are both monoclonal antibodies against this toxic amyloid protein. They're given by an intravenous infusion. They go across the blood-brain barrier, which is the difficult bit. They get into the brain, and they remove that amyloid protein. And the clinical trials which have been done, which we've been involved in all of these, both in our UK sites and in our US sites, they have demonstrated that not only do both of these medications very efficiently remove this toxic amyloid protein back down into the normal range, but doing so correlates with a slowing of the progression of cognitive symptoms. And it's that clinical meaningfulness that is most important. So, to be honest, the sort of like big message today, which actually the public are saying in this amazing report that's just come out from the Alzheimer's Association, is they want to know if they have these abnormal amyloid, and there's another protein tau, these abnormal amyloid and tau biomarkers indicating the presence of the disease in the brain, and they want to get access to early treatments to correct that, which of course is completely logical. But the big message is you have to do this early. So that's very mild symptoms, because once you progressed beyond that, we have something called MCI, mild cognitive impairment, and then there's mild AD dementia. Once you progress beyond that point, then these drugs are no longer effective. In fact, they're not licensed once you've gone beyond that point. And again, this is why this correlation or this relationship with Sunday Health is so critical.
Okay, I pulled up that press release. This is great information. And okay, so and forgive me if I'm not using the correct language, but the blood biomarker test. Can I get that the blood biomarker test through both or one or the other of your organizations?
So the answer is yes. But just to sort of like in terms of clarifying this with respect to people wanting to get a full diagnosis, biomarker diagnosis, and wanting to embark on the treatment program, and we can talk more about that. This is in the US, it is now today covered by Medicare and supplementary insurance. And we can talk more about this, but also even if you're not eligible for Medicare for some reason, it's important to check with your insurance company, because many other insurance companies will cover this up to 80%. So what's most important, rather than just sort of like flying off at a tangent and doing this blood test that it's called p-tau 217, is actually to sort of like, I mean, talk to your physician, but obviously it's an area that we have all the expertise in with Sunday Health. I would say, like, talk to us and we can explain how to do these tests so that they are all done in the right order and they're all covered, if not fully, in part by your insurance company.
Wow. I love this.
And Steve, just to jump in there and underscore that, I mean, a really big point of that is that the field is evolving, as I think you can tell and hear the passion in both of our voices, is the field is evolving very quickly. So, and this is nothing negative around our colleagues in primary care and even some other areas, but it's very, very difficult to keep up with the latest and greatest in what's moving, not only with the blood-based biomarkers, but also with the medications. So I think our advice would be get into folks who know what's happening and who are following it. Our focus is on this. Dr. MacSweeney's clinics are focuses on this. So it's really important to get in with physicians who understand what's happening, can guide you correctly, and to do it early, and really to jump in there and to do it. And so I think those are two really key messages. The other factor that we haven't really talked about beyond the medications, beyond the blood-based biomarkers, is just this idea of modifiable risk factors, and that there's a broader continuum of care that individuals can encounter and get involved with. So sleep management, socialization, hearing loss, diet, exercise. These things are, especially diet and exercise, are batted around a lot, but they're actually quite really critically important in the broader aspect of things as well. So, and these new treatments and this whole movement is creating a paradigm shift that is very similar, in my opinion, to if you look back at cardiovascular care or diabetes 30, 40 years ago, right? So a lot of patients and listeners, Steve, have probably heard of an A1C. A1C is the most common blood-based biomarker for diabetes. Understanding where your A1C is early is really, really helpful in taking control of your blood sugar. And there's now not only diet and exercise, but there's medication specifically suited to that. like Dr. MacSweeney said, the best thing you can do is start early. So in this case, it's no different. Get in there, understand your p-tau 217, as Dr. MacSweeney pointed out. There are others as well that get complicated quickly, so beyond the scope of this. But it's good to get that whole constellation of inputs and then to move into treatment if it's available, clinical trial, and the surround sound of the modifiable risk factors as well.
I love
And
it. Yeah, and really, I mean, I hear personally too many stories of people that went to their primary care physician and then got a referral to a neurologist where the not disparaging that
Yeah.
profession, but this requires, as you all are illustrating, a deep understanding of this issue and the resources that are out there. I'm delighted that to learn about this myself, that the two of you are connected. Now, right now, Dr. MacSweeney, you have a Fairfax, Virginia clinic. You're a global company, but you have a Fairfax, Virginia clinic, and Sunday Health has a growing footprint that's currently based in this DMV marketplace. What are some of the programs and things in this DMV area that folks could be utilizing Recognition Health for?
yeah, of course. No, thank you. And actually, just before I answer this, I do want to back up what Doug was saying about this isn't just a Fairfax problem. It's not just a US
Oh,
problem.
it's global. Yeah.
It's a world problem. And we have exactly the same in the UK. And in fact, last week I was doing some presentations to doctors in UAE and in Saudi, and everyone has this problem. So, like in one respect, it's so exciting because it just means for the first time there's opportunity and a chance to change your future. But it's also almost like hitting us like a tidal wave in terms of we recognize there just are so many people because this is a pandemic and it was labeled as a pandemic by WHO in 2018. So it's big. So act fast. So specifically zoning down into the DMV area. So we offer two things. With respect, we do lots of things, but with respect to this cognitive problem. So one is, as you say, we do have a number of clinical trials for which we're enrolling currently. And also new trials are opening all the time. So these are big global international clinical trials. So they'll be in our Fairfax Centre, we'll have them in our other centres, but they'll also be in Australia and all across Europe, like all across the world. And I think the most important thing to emphasize is that these trials are for yet more new medications. And as you might imagine, any new medication now has to be better than one of the two medications that have just come on the market. And even the same pharmaceutical sponsors, Eli Lilly and Eisai, that have Kisunla and Leqembi, respectively, they have other new medications that are in development now as well. So the first thing is that we can offer people clinical trials. One of the things I would say, and I think this is very exciting, is that we can also offer clinical trials, and we got some new ones coming for prevention. So the big move now, obviously what's going on in clinical trials is always years ahead of what's actually going on in clinical medicine. And that's always the case. And so one of the things that we can do is, because we've got so much experience, I mean, as a company, as Recognition Health, I don't want to say anything that's not true, but if we haven't got the most experience in the world, we've definitely got one of the greatest level of experience in the world. We've given over 10,000 of these intravenous treatments. So not only are we able to invite people into clinical trials, new further clinical trials, but we're also able to provide the treatment safely, efficiently, effectively, and with a huge amount of experience. The reason I mentioned the sort of cognitively normal, if you like, clinical trials is that this will be the future, because the buildup of these amyloid and tau proteins start years before an individual develops the first symptoms. It's a bit like cancer. The cancer is going on for ages before you actually realize that you have a cancer. And the new treatments will be designed to actually pick up the presence of these biomarkers, which are super sensitive, and to then give people a treatment to prevent them developing cognitive decline, or at least push out the time at which they might otherwise develop cognitive symptoms. So, I want to sort of like say there's a revolution going on at the minute in sort of like cognitive decline in the context of early Alzheimer's, and we can treat people and provide most accurate diagnosis biomarkers in the world, and that scans as well as blood tests, etc., and cognitive assessments for people to either enter into a clinical trial or to have active treatment on the market. And I would just say one last thing as well is we have very sophisticated cognitive assessments, because I'm sure there's someone out there thinking, well, I know there's something wrong, but nobody else can detect it. And this is so common because people who, just like any athlete or anything else, who just do have a really good brain, have a very high IQ, and have had lots of formal education, they know there's something wrong. But a lot of what I'd call the day-to-day tests that you might just have done in your primary care physician or whatever, they are not sensitive enough to pick up these early symptoms of mild cognitive impairment. So we're doing that. So we can pick up very mild symptoms.
Yeah, both of your organizations are just pioneers in the early detection world, but it takes somebody picking up the phone, setting an appointment, and being brave enough. And I say brave enough because so many people that we talk to, it's sort of like we saw things going on 3 to 5 years ago. Now we realize what it is. I love how you frame this as a revolution. We need, as consumers and providers, to encourage early detection. And what I love about what you're saying, and what I love about Recognition Health, is what you said earlier, is the people that are in these trials are the true pioneers. I mean, they're getting treated years before the general public. This is amazing.
Yeah. I mean, people we have been treating with Cosentla and Leqembi, we've been treating them over the last few years with these medications because they've been in the clinical trial. In fact, most of them all came into the clinical trial back at the beginning of lockdown. So yeah, they've been on these medications for quite some time. And yeah, it's I think the reason why there's two things which I would say, and again, I'm sure Doug experiences this as well. The biggest misunderstanding is that it's normal to start losing your memory and your other cognitive facilities as you grow older. That is not the case. It's not normal. It's common, very common, but it's not normal. And the second thing is there are treatments now. So this is not a disease to be afraid of. The biggest risk is if you don't do something about it early. And I would say, like most things, in the end of the day, the person who cares most about whether you might be at the very beginning of a progressive cognitive condition is yourself and the people closest to you. And just take authority for determining your own destiny. Don't wait for somebody else to decide upon that.
This is great. Man, I am blown away, and I'm going to scream from the rooftops, both of your organizations and how you're working together. Is there anything that we didn't talk about today that you really want the public and the provider community to know?
Steve, just one thing I'd mention is that, one of the problems with the system today is that there are so few neurologists and so many patients. So the idea of, having to wait for 6 months, 9 months, in some areas, it's even 12 months for a neurologist. That's just a really unfortunate byproduct of the way our system is situated. We are able to see patients very quickly, and with the partnership with Recognition, able to move much faster, which hopefully everyone is hearing that the earlier the better, again and again. So moving into it and going aggressively at it is usually the much preferred method than having to wait, and then you're waiting longer, and then you're waiting for something else. So if you're going to go after it, go after it.
Yeah, and I will say, having gone through the Sunday Health system, it is streamlined, it is easy, and it's quick. And I will tell you, I've talked to, again, folks that have gone through that 6 to 9 month wait time. Then they aren't getting the attention, but then they get the results, and nobody's sitting down and talking to them in detail about that. And what do they want to do? Get a second opinion, wait another 6 to 9 months. Folks, working with Sunday Health, Recognition Health, you can get more immediate results, and don't miss that early detection window, you know.
Yeah. And I would just say as well is that, by the time you're developing symptoms, you're already 15 years into the disease. And the rate of acceleration of symptoms increases with time. So actually, this window of opportunity when today you're eligible for treatment with these new types of treatments is actually relatively short. And anyone who is waiting 9 months or waiting 12 months has an incredibly high chance of missing their opportunity for treatment during that waiting period. And the way to think about this, to be honest, is exactly the same as cancer. If you have cancer, you want to get a disease modifying treatment as quickly as you possibly can, because you're going to have and all the studies have shown you have better results if you're treated when your symptoms are mild. And the other thing is that you may not have Alzheimer's, you might have something completely different. It may be a mood problem, it may be low thyroid, it may be B12 folate deficiency. There's all sorts of other things as well. And if you have a reversible cause of these cognitive symptoms, you want that detected and treated and reversed as quickly as possible too. So there is zero benefit in waiting.
I love it. I'm going to share links so that folks can get in touch with both of you and your teams. I really appreciate your time with me today, and keep on revolutionizing the treatment of this horrible disease. And like you said, it's pandemic. I mean, it really is. So thank you so much for your time today.
Thanks, Steve. Appreciate it.
Thank you.